So a lot of people carry on about vaccine and injury, right? I've seen for 3 years now, so many channels, so many people carry on about everything except, once again, the people that are forgotten always are the people that become suicidal, are self-harmers, or people I would never see, except for the fact that the experts locked people down. And then those same experts want to go on and say, let's do studies on the increased suicide rate. Or if it serves CDC, they will change that data and say, no, there was no increase in suicide. They are not in the trenches, so they don't know. Okay? Because the fact of the matter is, before this even got off the ground, I was saying we cannot lock people down. The very people, so I get tired of hearing people carry on. It's not that I don't care. It's that long before any shot came, there were people suffering and dying because the experts chose to lock people down. The experts of science chose to do everything that is against science. They've learned their lessons. They did this in the past. There was papers written about it, that you shouldn't mask everybody. I mean, it's amazing to me. The entire medical profession at the top seem to have forgotten that there's some things we need to be exposed to. It helps build our immunity. But we should protect the elderly because they have more compromised immune systems. And what did the experts do? They did everything to hurt them. They locked, if they were in nursing homes, they locked them in their rooms for 2 years, maybe even longer than that. Wouldn't even let them in the day room. They couldn't hug their loved ones. These people live for seeing their loved ones. And what did the experts of Harvard and Yale and all of Columbia, all of these universities do? They made everybody locked down. And then they kept the elderly locked down. They kept children in masks, even though so many studies had said that it didn't affect children. Not on the rates for them to even have to wear masks. They terrified people deliberately because they should have known the data. They did. So when I hear people want to go off on Trump and vaccines, I think, do you ever care about the people that have committed suicide? No, nobody ever does. These are people that were the most vulnerable, that could not even touch their family members, could barely see them, maybe see them through a window because the experts are crazy. They didn't protect anybody because, again, I didn't hear any of those higher educated experts talk about quality of life. One of those things, again, I was taught in nursing school. I'm sure there's other nurses that were taught about it, that if you take quality of life away from somebody, then you will not save a life. So here's some statistics. In early August, the U.S. Center for Disease Control and Prevention reported that more Americans lost their lives to suicide in 2022 than any year on record. Any year on record. Recently released provisional data found that last year, at least 49,449 Americans tragically took their own lives, amounting to almost 15 deaths per 1,000 people. Do those experts on all those Rumble channels that want to talk about injury from a shot, do they ever care about this? Never. Not even the experts do. Why would that be? Well, because they would see people with a mental health problem as weak, right? Those are that's what eugenics would see. Those are the weak-minded, the feeble-minded, which is why they don't care about them. As the Associated Press reported, the data suggests that today suicides are more common and prevalent in the United States than at any period since the beginning of World War II. Since the early 2000s, the rate of lives lost to suicide has been rising in the U.S. and in 2018 tragically reached its highest level since 1941. And yet what infuriated me is there was not any psychiatric professions that put out some sort of plan about how we should help people because of what the experts did by locking them down. No, they just relate it to something totally. Don't ever consider that lockdowns had an effect on people and children, that lockdowns had an effect on families, that masking people 24 hours a day decreases oxygen has an effect on people. Not considering any of that and putting in place some sort of plan of how we can address this with people. Because maybe their depression, and if they're suicidal, is from the very fact that the experts took away everybody's quality of life. No, they wouldn't want to do that because they know that then it implicates them. So when I really go off on the nursing profession, it's for good reason. Because there should have been some, it totally blows my mind that there was nobody at the Psychiatric Association, nobody in the nursing, American Nurses Association, or any of these unions that all these experts are at, that ever considered what the ramifications would be to children and the elderly, the vulnerable, because of lockdowns, because of masks. And there's only one reason they didn't want to address it. Because they know it makes them look horrible. Youth suicide rates increased during the COVID-19 pandemic. This is a known fact. Now, CDC loves to play with these numbers. They do. I don't trust their numbers ever. Because, one day it's, oh no, there was no deaths increase during, it's like, yes, there was, and it wasn't from COVID. You know that most of the numbers for deaths of suicide are almost always lower than what they report. And that's because there's many families that don't want to report that their loved one committed suicide. Now, that's seen more in countries overseas, but it also is seen here based on the culture. So every number I just pointed out is higher than what's reported because there's some that never get reported. Or maybe some of those suicide deaths, I guess if they died with COVID, the hospitals needed to get that money, right? So they would label them just like they did motorcycle accidents as a COVID death or shot injury. So the experts wanted to protect the vulnerable and look at what they did to the vulnerable, to the young and to the old. And one of the biggest problems nobody wants to seem to address, that is in leadership at American Nurses Association and elsewhere, is this continuing problem we have in mental health. A suicidal patient meets a healthcare system with little to offer. Yeah, we have little to offer since COVID too, even less than we did. Yeah, these things are not hard to fix. But as long as we have experts that are too filled with their ego and going along with things they shouldn't be going along with agendas that take quality of life away, then you won't get to solutions. You will continue to have the elites, the experts of nothing come in and tell everybody what to do and end up in the end hurting more people than helping. And anybody who's paying attention knows that in Canada, they're using MAID now for the mentally ill. And MAID is the medically assisted suicide. Canada releases first nationally accredited assisted suicide training curriculum for health professionals so that they can help those that are suicidal carry out. Yes, carry out. Because it's eugenics. Because they see those people as a too much of a burden on the system. That's who the experts are. That's why they never fix a damn thing.